My name is Mallory Ramond, and I am a neurotologist and assistant professor at the Mayo Clinic, Florida. My expertise is in the care of patients with otologic and neurotologic conditions, which include those of hearing loss and dizziness. When we dive, our body is exposed to increasing ambient pressure. The pressure around us goes up. When that happens, the airspace underneath our eardrum wants to get smaller. And in order to keep that airspace at the same pressure as the environment, we have to push air across the eustachian tube. That's the tube that connects the back of the nose with the space underneath the eardrum. And that's called equalization. Many of us do this with a maneuver called the Valsalva, which is where we pinch our nose and we blow air into the back of our mouth and throat, which allows that eustachian tube to open. But what if our level of challenge prevents us from even being able to pinch our nose? What then can we do? Well, we're used to diving with a buddy, so we can turn to the buddy system, who knows that we have a certain level of challenge and can help us perform one of those maneuvers by aiding in pinching our nose. We can signal to our partner that it's time to Valsalva with a tap tap or a hand signal that we come up with ahead of time. Typically, I recommend frequent and early equalization of the ear. So that means every breath or every 2 breaths as we descend. As someone who takes care of patients with ear conditions, especially those of hearing loss and dizziness, I recognize the value of staying connected to your surroundings, your community, and your environment. I personally have turned to diving to bring peace and wellness to myself. And so on a personal level, I value that experience and would like to be able to keep the patients who I take care of with ear conditions diving as much as they want to dive. We can keep imagining. The possibilities are endless when the goal is to keep divers diving.